So I come from a family of physicians. My mother practiced as a pediatric endocrinologist, my father as a neurologist and as a researcher. So for my brother and I growing up, our passion was always medicine. The beautiful aspects of our Center for Cancer Care at White Plains Hospital are the excellence of the physicians, the nurse practitioners, the nurses, and all the different healthcare providers that are involved in the care of the patients. The approach to the care of the patients is a multidisciplinary approach, which includes medical oncologists, radiation oncologists, surgeons, pathologists, radiologists, and varied complementary care individuals that are all focused on the total human being. So if a patient comes to White Plains Hospital with a cancer diagnosis, at that one center, within that one building, you're able to get that multidisciplinary approach where all the different aspects that are important for the care of the patients will be addressed and managed. So from this early diagnosis standpoint, we're moving fast, and I think we're already at a point where we can start to envision a situation where patients can come into a doctor's office and get a simple blood test. And that blood test can then evaluate for alloantibodies looking for various cancers that may be growing in their bodies. And through that simple blood test, we can then potentially detect a breast cancer or a lung cancer or a pancreatic cancer before we could even detect it on an imaging study or before we can even detect it because the patient is having symptoms. And that technology is already there, and that we're probably 5 or 10 years away from that point. With regards to therapy, we're living in a completely different environment where we have immunotherapy, where we have targeted therapy, where we have very specific targeted forms of radiation therapy, where we have combinations of the various treatments in order to minimize side effects and in order to enhance the likelihood of curing our patients. We're really able to find what is the best therapy for our patients, what is the best approach to taking care of the patient, and what are the best avenues moving forward for that patient.